Hi everyone, today we are going to see a group-based discussion on topic called laparoscopy. So here the students second year BME is with us, so they are going to have a discussion on a topic called laparoscopy. So laparoscopy is nothing but is a kind of modern surgical procedure where a small incision has been made to carry out a surgery process. So here in this video the students going to have a detailed discussion on how this laparoscopy is, keeps on working, how it's been changing the surgery procedure and so on. So and then also these people going to map the every stages of DT by connecting with the real-time clinical expertise. So let's have this discussion right now. Hi guys, shall we start the discussion now? Yes, first give introduction of yourself and then we'll move on to the topic.
I am Nandini K from second year biomedical engineering. Our title is Laparoscopy DT based group discussion. Today we are discussing laparoscopy through DT method. This method helps us to understand how this technique improved, how it helps in patient care.
Yes, who is going to initiate this topic?
My name is Shahana, and on continuing the introduction part, I'm just going to say this laparoscopy is an advanced method for the doctors to have to reduce the stress on the patients, and they also have their own needs where they can have a clear picture of which place they are going to do the surgery. So it is a very good method.
So I'm going to tell the problem state of the discussion. So I'm Vishnu Priya from second year biomedical engineering. The main problem of this statement is normal surgery. Basically, a normal surgery consists of a large cut and a wide opening inside the body. It causes heavy bleeding and it makes the patient to stay in the hospital for more time, increasing the risk of infection. So while opening the body, there's a case of more blood loss and there is a stress on the internal organs.
Adding points to Vishnu Priya, many patients fear for open surgeries and doctors also facing the many challenges during the operation. So this problem pushes the medical field to look the safer option.
Here we have to start in the empathy stage. Here we focus on the needs of patient and their surgeons. Patient needs small cares, quick recovery, less pain, and to get back to their normal life. So they also need fewer complications after surgery.
On continuing with the empathy stage, as I said, surgeons have their own needs. They need a clear and visible picture of their small openings on the body. So these visibilities will lead them in the correct direction to take over the surgery. So this visibility and their needs and these sharpener needs, it is required and it is there in the laparoscopy, in the modern technique, that it reduces in every ways to the surgeons.
So as a conclusion of empathy stage, we come to know that both surgeons and patients need an effective treatment to carry out the surgery with minimal blood loss, right? So here comes actually solution of what is laparoscopy. So now I would like to ask anyone to explain what is the ideology which is behind in the laparoscopy technique.
So I can explain the idea of the problem statement. So what is the idea of laparoscopy is the problem is there is a wide cut in the body. So the main idea of laparoscopy is to make a tiny cut inside the body and sending a minimal tube with camera inserted in the tip of the tube. So we can see the internal side of the body through that camera in a monitor. So the major blood loss is also reduced. As the cuts are very tiny, that is less painful and they will get rid of pain very soon. So this is the laparoscopy.
Adding Vishnu Priya's point, other cuts are used to insert small thin instrument inside. Surgeons can control everything from outside while watching the monitor. This is very patient friendly.
And now we are going to tell about the exploration of uses. Laparoscopy is used in many fields. Common procedures such as gallbladder removal, appendix surgery, and in many female reproductive system surgery. These also now growing in liver and kidney surgeries now.
So on exploring the other use, because laparoscopy is a preferred method by the doctor, because it reduces the blood flow, and because these cuts by the method is very small and the blood loss is also lower. Also, the patients get bounced back quickly. They return to their home in very short time, and they get, as the incision is small, their infection is also very low. So it gives many benefits.
So I'm here to say the benefits and outcome of laparoscopy. So as I already mentioned, the cuts are very small. So the muscle and tissue intact, that will be stayed intact all over. So the laparoscopy decreases the whole trauma to the body, as the cuts are very small and there's only small opening instead of wide opening in the body. So the pain of the laparoscopy procedure is also reduced in only very few hours after the surgery.
Adding Vishnu Priya's point, by the surgery the scar is very tight, the patient feel comfortable and confident. It is very fast healing process.
So yes guys, so far we have had a detailed discussion on what is laparoscopy, right? Now let me ask you one question. What is the difference between endoscopy and laparoscopy? In what way it get differ?
So let me break down the difference between endoscopy and laparoscopy. There is a similarity between them. Both is monitoring the internal organs of the body through a monitor. So if the monitoring device is sent through the natural opening like mouth or anus, it is said to be endoscopy. If there is a small cut made in the body and the monitoring device is sent inside, that is said to be laparoscopy.
Yes. So based on the application, we can go with endoscopy or laparoscopy. So, but the main thing is, as Vishnu Priya said, it is just to diagnose the problem, whether it is there or not. If it is there, meanwhile we can operate also. Yes. Now I think now we have come into end of the session. Who is like to close this group-based discussion?
I would like to close this and closing of this method. When we connect laparoscopy with the DT process, we can view the technique from real needs. It starts with the small problem and moves towards the solution with many comfort and safety.
By listening to the surgeon needs and the patient needs, this surgery method has evolved into the most advanced method, which gives low side effects and low infectious, and gives an healthcare in an advanced level.
So indulging our problem statement into DT based theme, it helped us to break down the topic into several parts, that is ideate, empathize and etc. So this helps us to understand the clear problem statement and helps the user to find the clear solution for it. Thank you for listening our discussion on the laparoscopy DT based discussion. Thank you.
Yes, thank you. I hope so you like this video.